Welcome to this video on the introduction to antibiotics and their classes. My name is Angama Joshua, and today we will be exploring the basics of antibiotics. By the end of this video, you would have a solid understanding of the different classes of antibiotics, their mechanisms of action. Plus, we'll finish up with a few practice questions to help solidify your knowledge. Let's get started. So what exactly are antibiotics? Antibiotics are medications used to treat bacterial infections, and they can either kill bacteria, in which case we say bactericidal, or inhibit their growth, or bacteriostatic. It's important to remember that they only work on bacteria and not viruses. Antibiotics were first discovered in 1928 when Alexander Fleming accidentally discovered penicillin, a groundbreaking discovery in medicine. Let's talk about the mechanisms of action of antibiotics. There are four major ways antibiotics work. First, by inhibiting cell wall synthesis. This is crucial for bacteria because the cell wall protects them from the environment. Second, by inhibiting protein synthesis. Without proteins, bacteria can't survive or reproduce. Third, by inhibiting nucleic acid synthesis, affecting bacterial DNA or RNA, preventing their replication. And fourth, by inhibiting metabolic pathways such as the folic acid synthesis, which bacteria need to grow. Understanding these mechanisms helps you choose the right antibiotic based on the type of bacteria and the site of infection. Now let's break down the main classes of antibiotics. These include the beta-lactams such as penicillins and cephalosporins, which inhibit cell wall synthesis. The macrolides like azithromycin, which inhibit protein synthesis. Fluoroquinolones such as ciprofloxacin, which disrupt DNA synthesis. Tetracyclines like doxycycline, which block protein synthesis. Aminoglycosides such as gentamicin, which also inhibit protein synthesis. Glycopeptides like vancomycin, which inhibit cell wall formation. Sulfonamides like sulfamethoxazole, which inhibit folic acid. Antibiotics can also be classified as broad spectrum or narrow spectrum. Broad spectrum antibiotics are effective against a wide range of bacteria, making them useful in treating infections when the exact cause is not known. Narrow spectrum antibiotics, on the other hand, are more specific, targeting certain bacteria. The choice between broad and narrow spectrum depends on the infection being treated. Let's look at the important classes. First up, we have the beta-lactams. These include penicillins, cephalosporins, and carbapenems. They work by inhibiting cell wall synthesis, targeting the penicillin-binding proteins in bacterial cell walls. Beta-lactams are bactericidal, meaning they kill bacteria directly. Penicillins are often used for streptococcus infections and syphilis. Cephalosporins, meanwhile, come in generations. The first generation, like cefazolin, is effective against gram-positive organisms, while later generations, such as ceftriaxone, cover gram-negative bacteria. Next, we have glycopeptides, and the most important one here is vancomycin. Vancomycin binds to the peptidoglycan precursors, preventing proper cell wall synthesis. It's primarily used for gram-positive infections, especially the methicillin-resistant Staphylococcus aureus, also known as the MRSA. Vancomycin is typically used when beta-lactams are ineffective due to resistance, especially in hospital-acquired infections. Moving on to the aminoglycosides like gentamicin and tropamycin. These antibiotics bind to the 30S ribosomal subunit, inhibiting protein synthesis. They are primarily used for serious gram-negative infections. However, you need to be careful with these drugs because they have some significant side effects, including nephrotoxicity and ototoxicity. Monitoring kidney function and hearing is essential when using aminoglycosides. Next up are the macrolides, including erythromycin and azithromycin. These drugs bind to the 50S ribosomal subunit and inhibit protein synthesis as well. But unlike aminoglycosides, macrolides are usually bacteriostatic. Microlyte are commonly used for respiratory infections, chlamydia, and for patients allergic to penicillin. Azithromycin in particular has a long half-life, making it a popular choice for outpatient treatment. Tetracyclines such as doxycycline are another class of antibiotics that inhibits protein synthesis by binding to the 30S ribosomal subunit. These are broad-spectrum antibiotics and are used for infections like Lyme disease, Rocky Mountain spotted fever, and acne. One important point to remember, tetracycline should not be used in children under 8 years or pregnant women due to the risk of tooth discoloration and bone growth inhibition. Fluoroquinolones such as ciprofloxacin and levofloxacin inhibit DNA gyrase and topoisomerase 4, which are crucial for bacterial DNA replication. These antibiotics are especially effective against gram-negative organisms and are often used for urinary tract infections, gastrointestinal infections, and respiratory infections. However, fluoroquinolones have some significant side effects, including tendon rupture and QT prolongation, so they should be used with caution. One major issue we face today is antibiotic resistance. Overuse of or misuse of antibiotics leads to the development of resistant bacteria. These bacteria adapt and find ways to survive, making antibiotics less effective. To combat this, we need to use antibiotics only when necessary and always follow proper medical guidance. Now let's test your knowledge with some practice questions. Question 1. Which antibiotic class inhibits cell wall synthesis? The correct answer is C. Beta-lactams inhibit the penicillin binding proteins inhibiting cell wall synthesis. Question 2. Which antibiotic binds to the 30S ribosomal subunit to inhibit protein synthesis? The correct answer is B. Gentamicin. Remember, aminoglycosides bind to the 30S subunit to inhibit protein synthesis. Question 3. Which class of antibiotics is most commonly associated with nephrotoxicity and ototoxicity? Correct answer is C. Aminoglycosides. Monitoring renal function and hearing is crucial when using these drugs. To sum up, antibiotics are powerful tools in the fight against bacterial infections, and understanding their mechanisms of action is critical, not just for your exams, but for your future clinical practice. Review these classes regularly and practice with clinical scenarios to master their use.